Very good morning to all. This is an interventional study which was carried out during my MBA thesis program from BITS Pilani. The role of healthcare management for screening of diabetic retinopathy in rural India. It was a pilot study. The study was carried out in association with the Queen Elizabeth Diamond Jubilee Trust, UK, the London School of Hygiene and Tropical Medicine, Indian Institute of Public Health, Hyderabad, Government of Maharashtra, NPCBVI, and Department of Ophthalmology, MJMS. Diabetic retinopathy screening guidelines prepared by the AIOS Task Force Committee and the Vitreoretinal Society of India provides a framework for DR screening that is currently feasible in India. The present study helped in assessing the impact of healthcare management with the help of using this guideline practically among the rural Indian population in state of Maharashtra. As a clinician point of view, timely screening is utmost important for prevention of blindness in diabetic patient, but this study also emphasized on healthcare management intervention in making optimal DR screening with amalgamation of recruitment, training, orientation of healthcare workers, data management, dynamic referral system, and use of technology. Aim to study the impact of healthcare management intervention in screening of DR in government health facility, to recruit ophthalmic officer from healthcare facility and train them for use of non-mediatic fundus camera, teleophthalmology, and AI software for screening, to train and orient the healthcare worker for streamlining of DR screening. This is a prospective interventional study conducted at 5 government health facility of 5 blocks in district, which included initial 1 year followed by 4th month of screening with intervention. The following are the healthcare intervention carried out. Number 1, education and training of the village health worker like ASHAs, ANMs, midwifery, NCD staff, and paramedical ophthalmic assistants by creating awareness in DM patient using pamphlet and information booklet which were given in local vernacular language. By creating awareness by displaying poster message in the local language in NCD clinic and eye clinic waiting areas. Training of the NCD staff and PMOA for using non-magnetic fundus camera and online DR screening software. DR screening was done at the government health facility and not at the CHC also, but at PHC and even at the subcenter level. In this, non-magnetic fundus camera were used by the PMOA or the NCD staff, and provision of transport to diabetic patient from village to the PHC for DR screening, which was done with the help of the healthcare workers. Data entry was done on the diabetic retinopathy clinical performa and online DR softwares. Reporting of all these photographs from the DR database by ophthalmic surgeon at the base hospital, sending the respective government health facility via teleophthalmology. All the patients with DR were referred to the base hospital and were treated with taking fundus photographs, FFAs, panretinal photocoagulation was done, intravitreal injection, and vitreoretinal surgery was done. In phase 1, 2,794 known diabetic patients were screened, which is approximately 20% of the 13,890 registered diabetic patients in the 5 block. And the phase 2, where the intervention was applied only in the 4 block, remaining 1 as a control, 590 ASHA workers were trained, 9 paramedical officers were trained for taking for photograph and use of teleophthalmology, in which 2,210, which amounts for 16% of the diabetic population, were screened. You can see a spike in the number of patients screened with the intervention in the last 4 months in the 4 block and decline in the control block. This is a trend of the screening data. Total 5,004 patients were screened, out of which 375 were referred and 81 patients were treated. You can see that the referral is maximum in the blocks where intervention was done. Total 8776 eyes in which fundus photographs were gradable. 668 shows diabetic retinopathy changes with prevalence of 7.62%. These are the number of investigation and management numbers given in the tables. So the present study highlights the important role of following healthcare management intervention by diabetic retinopathy screening at the government health facility, education and training of the village health worker, DR screening with non-magnetic fundus camera by trained PMOA, dynamic referral system, use of data entry storage software, cloud computing, use of teleophthalmology, and further management referral to the base hospital. The present study helped in assessing the impact of healthcare management, manpower, operational effectiveness toward the optimal service provision for screening of DR in rural India, its effectiveness, financial sustainability, quality of service, evaluation, monitoring, and further follow-up of the disease. In order to tackle the rising problem of avoidable blindness due to DR in developing country like India, such DR methodology can be streamlined in the rural population. Future planning are monitoring and pre- and post-training evaluation of the intervention done, reflection, follow-up, and more robust use of teleophthalmology, AI, and inclusion of machine learning for the screening purpose. Thank you so much.
how is your model different from all others like Shankar Nathralaya, LVP or Chitragood or any other? How is it different?
Sir, as I said that ki AIOS task force mein all this methodology has been mentioned that you can use these things, but we have intervened with the help of DR online software we used. We provided tabs to all the healthcare facility where these were used by the NCD staff, and the online entry was done, and internet was provided with the dongle, and all these photographs were transferred and were taken by the healthcare profession, not by the ophthalmic surgeon. These were done by the paramedical staff and referred to the base hospital. We done it, the ophthalmic surgeon screened the photographs and sent the report, then the patient were referred with the help of the paramedical staff and the health workers. We compared this comparison of the screening by the ophthalmic surgeon with AI softwares. How much the AI software is helping out the success of the AI to detect, that is the mild NPDR which is detected by the ophthalmic surgeon, or a PDR or advanced PDR.
Thank you, Dr. Azhar Mohammed.